Okay, now we are at number 5, 28 weeks and 3 days. So let's start by the situs, the stomach. This is the heart. And what do we see? Is the interventricular septum intact? I wouldn't say so. And we see that the aorta, the outflow, is in actual fact overriding the defect. And we also see that the pulmonary artery that we see next to it is very small. We can see, can you see it? Is very clear. Now we see very clearly that tiny little vessel next to the large aorta. And we see here the 3-vessel view with one dominating vessel and the other 2 rather small. So was this case normal or abnormal? I would say definitely abnormal. And the diagnosis is here a tetralogy of Fallot. So let's see what you made out of it. And I will remind you that the tetralogy of Fallot is, there was a 33% that had the right diagnosis and the other 33% the truncus arteriosus, which I must say resembles the tetralogy of Fallot. But in this case, we could see very clearly that the pulmonary artery was in actual fact present. And it was a tiny little vessel dividing, and it was not coming from the main vessel. But in a way, the truncus arteriosus has other possibilities quite plausible. So what are the elements of the tetralogy? The VSD, the overriding of the aorta and the small pulmonary artery. There are cases where the pulmonary artery is not that small, and those are the so-called pink tetralogy of Fallot. But obviously in the course of pregnancy, there may be a deterioration, and there is also the extreme case where the pulmonary artery is extremely small, and then in that case, it could even be similar to the course of pulmonary atresia. It's very important in this case to do invasive diagnosis for a 22q11. I mean, there may be people who prefer to do it non-invasively, but I think it's very important also because nowadays there are other conditions that could be often associated to this anomaly. We know, for instance, that Buki syndrome can be in some cases also associated with a tetralogy and or with other severe heart anomalies. So I think that in this case it's always very, very important to do invasive prenatal diagnosis. Asma, what do you think? Do you have something to add?
No, I think you sort of you explained it nicely, and you demonstrated the abnormalities on the scan. You did also mention sort of different types of tetralogy of Fallot. I mean, also there is a type of tetralogy of Fallot with the absent pulmonary valve, which is like the pulmonary artery is massive, and obviously there is, when you have the color Doppler, you will have the the flow in the pulmonary artery. And yes, of course, that's an indication for invasive testing. I think something like that, I'm not sure that I would be quite keen to offer self-Regain because, I mean, yes, George, but there could be other abnormalities as well. And I guess, certainly in my practice, the self-Regain will be maybe an option if they don't want invasive testing, but they still want to have some information. But even if it comes back as positive, you still have to confirm it with invasive testing. So, I think certainly the first line will be offering amniocentesis, for example, if they want to.
Another point is that a anomaly which is often associated, or let's say a feature which is often associated with the tetralogy of Fallot is the right aortic arch. In this case, it was not present. Another very common feature is that there is a deviation of the heart axis more to the left, but in this case was also not very spectacular, this deviation, so it was not really very evident. So I think we can go ahead with the case number 5, no, number 6.
How can you differentiate between tetralogy fellow and double outlet? Because they're sometimes very, very difficult to differentiate. And almost like some people would say it's like one spectrum almost.
Well, it depends on the degree of, let's say, of the rising of the aorta. The two conditions could go the one into the other very, very easily. But usually in the double outlets, the pulmonary artery, it doesn't tend necessarily to be small, whereas in tetralogy is really a classic feature.